Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Welcome to part 3 of our 3-part series. Ouabain is a cardiac glycoside that's traditionally extracted from the seeds of a certain African plant. When it's concentrated, it's used as a blow dart poison. In parts 1 and 2, we basically discussed how it's used, where it comes from, and the potentials that it may have. Well, it's been seen historically as this poison in folk medicine, but in history, it's been used very heavily as a cardiac sort of tonic, like digitalis has been or is. And so the potential uses for this amazing substance called Ouabain, one that's made by our adrenal glands, which we spoke about how it's ionotropic, chronotropic. This particular substance is helpful in congestive heart failure. Ouabain has been used to treat heart failure due to its ability to increase the force or the contraction of the heart. We call that contractility improvement or ionotropic effect. It also is dysrhythmic, as we noted before in the last session. It can help to calm down especially atrial dysrhythmias and definitely even in atrial fibrillation. It can help in blood pressure as well, and some studies suggest its role in regulating blood pressure is quite important. Heart failure, of course, we saw in severe cases, most of the time it can be used, although I feel it should be used much earlier, especially since when the body is healthy, it's producing this substance to help maintain that heart rhythm. And it is very much so, and this is a key that we have not mentioned yet, but we are in this part 3, that it is a parasympathetic enhancer. It literally improves the parasympathetic nervous system component, and you know most of us and most of your patients are sympathetically dominant. Hence, this becomes so important. It's extremely hard to find as a medication. In Germany, it's readily available, some other countries, but you may be able to potentially find what we call homeopathic doses. And this particular substance can have some great proclivity to help in the right time, at the right place for patients using this. And using good guidance, you might get an idea of what type and how much that patient should use. And some people say, well, how much should I get? And what do I use? So everything in homeopathy starts with the mother tincture. The mother tincture basically is the concentrate of the particular substance, and we'll talk about how to determine that. Other nutrients, just for a moment, that are quite helpful are magnesium, because it helps prevent the toxicity of Ouabain, as well as digitalis. Potassium plays an important role since this is a sodium pump inhibitor, and it's important to know that. And coenzyme Q10 should be taken simultaneously as well, along with the B complex vitamins, especially B1, because it does help the heart. So again, to go back to the mother tincture, which basically is the original undiluted extract, well, the guidelines that you can help you use, most tinctures which are made at 1 milligram pretty much per ml. So the tincture dropper, a dropper, is typically a half of ml. So this is the way you can basically calculate it, and as by doing the following. 1 milligram is typically 1 ml. Each drop is typically 0.05 mLs of Ouabain in this case, of course. And if you take 1 drop, you're getting 0.05, as we said. If you take 20 drops, which actually is 1 ml, you're getting 1 milligram of Ouabain. That's a good way of thinking about 20 drops equals 1 milligram. Sometimes you'll find the homeopathic little troches that you put in the mouth. They typically have 5 drops of the mother tincture. And of course, taking 1 or twice a day, it's 10 drops. And of course, 10 drops would be 5 milligrams basically of the Ouabain. And again, it depends how it's made. You need to ask the homeopathic remedies of that. We're going to talk more in the cardiovascular area. I think it's important. It is still the number one cause of death in our country, and we'll do a lot more of that. I'm Dr. Mitch Ghen. More information, just write me at drmitchghen.com, drmitchghen.com. Thanks for watching.